Hi, I'm Laura. I'm in the FNP DMP program here at Gonzaga. And while trying to figure out how I wanted to phrase my philosophy of nursing and healthcare, I kept thinking about Nurse 565, Clinical Prevention for Diverse Populations. The very first module of this class began with a quote from Nelson Mandela, and I quote, "Overcoming poverty is not a task of charity. It is an act of justice. Like slavery and apartheid, poverty is not natural. It is man-made, and it can be overcome and eradicated by the actions of human beings." While these aren't my words, they have become my philosophy of healthcare. People have a fundamental right to receive adequate healthcare, and it is up to healthcare personnel to ensure that every individual, no matter their race, age, cultural beliefs, their financial situation, or the disease with which they suffer, have access to healthcare. That gets really tricky when you're the middleman. And if you were 20-something when you graduated nursing school like I was, there's a good chance that you didn't quite understand what you were signing up for. But the more I learn, the more I'm understanding that we are the link between policy development and the patient bedside. When we became nurses and practitioners, we are not only obligated to pass our certification exams, we are obligated to continue on as lifelong learners, to be empathetic to lifestyles we may not understand, and to have enough self-confidence that we're able to stand up for what we believe in, even if our bosses and coworkers don't agree. And we are obligated to follow a code of ethics. Hear that, a code. Not a law, not a specific instruction for exactly how to proceed with things. A code. Generally understood by most people, but differently interpreted by millions. It gets a little overwhelming. And that's why I think it's so important to have a nursing philosophy. That passion, that grounding. Whenever you think about it or read it aloud to yourself, it fills you with purpose and reminds you why you became a healthcare professional. It brings you back to your roots. Every human being deserves dignity and the chance to be heard. Policies, finances, social determinants of health, these are not natural barriers. So I'll end with the end of Nelson Mandela's quote. Sometimes it falls on a generation to be great. We can be that generation. Let's let it blossom.